A missing tooth can cause shifting of the surrounding teeth, leading to gum disease and the loss of additional teeth. An implant to replace a lost tooth can prevent these problems. When placing an implant, a screw is inserted into the bone under local anesthesia. Within a few months, this initial implant will become a firm foundation set in position, replacing the natural root. The space with the missing tooth can be filled by a temporary crown. To create the permanent crown, a mold is taken of the implant and surrounding teeth, and the color of the natural teeth is examined in order to create a perfect match for the new crown. The new crown is secured onto the implant using a screw or a special cement. The new implant looks and feels like a truly integral part of the mouth. Please contact your dental professional today to see if dental implants are right for you.